Hello, everyone. Thank you for joining us with the Intro to Clinical Practice Simulation demo.
Hi, Anthony.
Hey, we're going to review our roles first. So, hi, everyone. My name is Anthony. I'm going to function as the simulation facilitator. I will also be the voice of the mannequin and control the mannequin's vitals. And I'm also going to be the scribe for the simulation.
I'm Nicole, and I'm going to be the nurse as well as performing the tasks, the defibrillator, and the meds in the sim.
Hey everyone, I'm Logan and I'm going to be a team lead today.
Hi everyone, my name's Will and I'm going to be the primary survey and CPR if we come to that.
Hi, and I'm Natalia. I'm going to be doing the secondary survey as well as managing airway if needed during the code.
For everyone's reference, on the left-hand side here are the different slides. Slide number 1 is the main resuscitation room. We have emergency record notes here that the scribe will type in the story. The orders as ordered by the team leader will be typed in the orders. The team roles will be typed in the beginning. So right now we can have team leader as Logan, so we all know. I'll put primary first as William, secondary and airway as Natalia, primary CPR, tasks, defib, meds, Nicole, and myself as the scribe. And if you forget what example roles there are, it's on slide number 4 over here. We have our airway equipment at the top, and you simply click and drag it on the patient. So when you do your simulations, you can decide whether or not you want the co-facilitator, the person playing the nurse, to do it, or one of your medical students ask the tasks person to do those. You can adjust the flow rate by typing in the liters per minute here. We have our other equipment, IV, blood work, IO, Foley, NG, blood pressure cuff, the monitor leads, saturation probe, thermometer, defib pads, glucometer. Vitals will be entered on the right-hand side by the facilitator by simply typing it in. Page number 2 will be a list of medications. Simply click, copy, and paste, or cut and paste into this medications given box. Slide number 3 will be all your airway equipment. Simply cut and put on the main slide. Slide number 5 and 6 are covered at the current time. As the case unfolds, we will delete that cover to reveal certain messages. After the case is done, teaching slides will follow. We have the systematic approach here to remind you of the systematic approach that you can take as you go through your simulations. Okay, so let's begin our demonstration. So this first simulation is about EMS bringing in a 65-year-old man with melena stools and lightheadedness to the emergency department. And the team walks in.
All right, let's get started with our initial steps, team. So since we're looking at the patient, what do we see, smell, and hear?
You're seeing a drowsy, jaundiced man, smells of an alcohol breath, and you can hear some moaning from the patient.
Okay, Nicole, can you get us some initial vitals and cycle the BP every 5 minutes?
Yes, you bet. I'll get started right away.
Okay, let me know when those vitals are back. Will, can you hook the patient up to the monitor?
Yep, I'll hook up the patient to the monitor.
Do you have any vitals back yet?
Yes, I have an initial set of vitals back. I've got 100. Oxygen level is 89% on room air. Blood pressure of 90/50. Rest rate of 22. Temperature is 37.3.
Okay, thanks, Nicole. So the patient's hypotensive with low sats and tachypnea. Can we get 2 large bore IVs started, Nicole?
Yeah, I'll get started on that right away.
And because the sats are low, we're also going to need some oxygen. So let's get the nasal prong set at 5 liters per minute. Will, can you do that if you're at the bedside?
Sure, I'll set the oxygen at 5 liters per minute.
Thank you.
2 large bore IVs are in.
All right, thanks, Nicole. And Will, after you're done, can you start running through a primary assessment and just walk through your approach to the ABCs?
Sure. I'm going to go through my primary survey. Assessing the airway, I'm going to assess, is the patient talking?
Hello, I'm Bob. What's going on? Huh? He appears confused.
So assessing the GCS, he appears confused.
His limbs are moving and his eyes are open. He is only confused.
I have a GCS of 14. Next, I would assess breathing. I would auscultate his lungs bilaterally,
Lungs are clear.
and I would check for any work of breathing.
He has no increased work of breathing.
Okay, next, I would check extremities if they're warm or cold. I would check for a cap refill.
His extremities are cool. Cap refill is 3 seconds.
And finally, are there any signs of bleeding?
There's no hematemesis and no bright red blood per rectum.
All right. Thanks, Will. So it sounds like we have delayed cap refill and cool extremities, so signs of hypovolemia. I think the patient would benefit from some IV fluid. So Nicole, can you get a 1 liter bolus of normal saline?
Yes, I'll get that started right away.
All right, and given the hypovolemic picture here, I also think we might need to consider transfusion down the line. So let's get a type and screen and cross-match blood, and as well as a stat CBC. So Nicole, could you draw up some blood and then I'll put in that order?
Yes, the bolus is running right now and I will get working on the blood work.
All right, thanks, Nicole. And so while we're waiting for that blood work to return, can I get Natalia to do a secondary assessment?
Yep, for sure. Is there some family around for the secondary assessment?
Yes, brother is around.
Perfect. So for my secondary survey, I'm going to start with the sample questions. First question is, how has Bob been feeling lately?
Bob's been feeling fatigued, lightheaded, and short of breath.
And does Bob have any allergies?
No allergies per se, intolerant to ibuprofen. He has arthritis, but it's been upsetting his stomach, so he stopped taking ibuprofen recently.
Okay. And what kind of medications does Bob take?
He's on a few: pantoprazole, metformin, perindopril.
And does Bob have a past medical history?
Peptic ulcer disease, alcohol use disorder, COPD, diabetes, and hypertension.
And when was the last time Bob had anything to eat or drink?
Nothing since last night. He had an alcoholic beverage recently, not sure when.
And then prior to him coming into hospital today, what has been going on?
He's saying to me he's been feeling unwell for the past week with nausea and melena stools, and he hasn't really been able to make it to his family doctor, so he came in to see you today.
So to complete my secondary survey, I'm going to do a head-to-toe clinical exam. When I look at his face, do I notice anything in terms of skin color or jaundice?
Yes, you see jaundice. There are no other remarkable features with the head and neck.
Okay, when I listen to his heart and lungs, do I hear anything like extra heart sounds or wheeze?
Nothing that you note.
Okay, and an abdominal exam, do I see any abdominal distension or evidence of ascites or any evidence of organomegaly?
Hepatomegaly is what you identify.
And then when I examine his peripheries, do I notice anything other than his cool extremities that we know of?
Still the cool extremities and the poor capillary refill.
Okay.
Your blood work is back.
Okay,
Please
over the
go
results.
to slide 5 to look at the blood work.
All right, so we got back a hemoglobin of 60, which is pretty low. So we're going to have to prepare for transfusion. To kind of round out our secondary assessment, I wonder if you could repeat the vitals, Nicole.
Yes, we've got a heart rate of 110. We have oxygen of 93% on 5 liters. The blood pressure has decreased to 87/43. And the rest rate is at 27. Temperature remains the same.
Okay, thanks, Nicole. Anthony, were you able to describe those vitals down for our records?
Yep, I can get on that.
Perfect. So let's report those vitals and start preparing for transfusion.
The patient's becoming extremely drowsy, vomits blood, and is breathing faster.
Okay, I was thinking we should start considering some of the other GI bleed meds like octreotide and pantoprazole, but given the change in the picture here, I think the ABCs are our priority. Specifically, I'm concerned about failure to protect the airway in terms of the vomitus and the increasing drowsiness.
He is now completely unconscious and not responding.
Okay, does he have a pulse? Or was it bedside?
A pulse is absent.
Okay, let's start CPR right away and we'll call for the code team to help. Will, can you do compressions, and Natalia, can you do airway?
Starting compressions.
I will start big valve next.
And then Anthony, can you just note the code start time and then document throughout?
I will note the code start time as 8:31 p.m.
Okay, and Nicole, I'll get you to attach the pads and let me know as soon as they're on because we're going to stop CPR for rhythm assessment ASAP.
Okay, pads are applied.
Okay, let's hold CPR for a rhythm check.
Holding CPR.
Bring your attention to slide number 6 for the underlying rhythm.
All right, it looks like we have a sinus rhythm in the context of no pulse. So I think that's a PEA. Would you guys agree?
Yeah, I agree.
I would agree.
Okay, so PEA is a non-shockable rhythm. Let's resume CPR.
Resuming CPR.
And Anthony, can you let us know when 2 minutes are up? Because at that time, we're just going to reassess the rhythm and pulse. And we're also going to swap compressors.
Will do.
Natalia, at that time, we're also going to try to establish a definitive airway.
Sounds good.
Nicole, we'll give 1 milligram of IV epinephrine every 4 minutes, which is every 2 reassessments.
Okay, I will get that initiated right away.
Time passes and the person is resuscitated. Good job, everyone. 1, 2, 3. Another
life
save.
save.
Okay, so just to let everyone else know here, at the end of each simulation, there's going to be teaching slides by the facilitator. The first slide is just a review of the systematic approach for everyone to see again. And then the facilitator will delete the covers and show you the teaching slides. Before the teaching slides occur, you'd first do a bit of a debrief within your team. You'd be talking about some teamwork strengths, teamwork challenges, as well as some biomedical concepts and questions. And then it'll end off by talking about the teaching slides. And that's it. Good job, Sim team.
Hi everyone, just some other features of the online simulation environment are as follows. In our simulation, we did not use the CPR hands, but you are free to do so by simply clicking and dragging the CPR hands over the patient's chest. We still want you to mime CPR though. We want you to demonstrate your great air CPR skills. Another thing to note is the monitor leads. In the simulation demonstration, we accidentally misplaced the leads. The white goes to the right. Then it is smoke or black over fire, the red. White on right, smoke over fire. Another functionality is the monitor rhythm. This is for facilitators to use. If you delete this black box, there will be an underlying rhythm. Depending on the case, there may be just one rhythm there, or if you delete it again, you may find a second rhythm. This will depend on the simulation case.
Good luck to you out there and enjoy the online sim experience. We'd also like to thank the creator of Virtual Recess Room, Dr. Sarah Fuhi. Thank you, Sarah.
Thanks, Sarah.
Thanks, Sarah.
Thank you.